Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. Today's topic is genetic assessment. So before proceeding into the topic, we must know, do we perform the genetic assessment to all the couples who is being conceived? No. We will do the genetic assessment only when we come to know that when we are considering the history from the patient and we have a query that there is a chance of developing the babies with genetic problems, we do the genetic assessment. Or the couple who have already have a living child with any genetic abnormalities or any chromosomal abnormalities. In that such cases, we will perform the genetic assessment for the subsequent pregnancies. Or even if they have undergone any stillbirth or miscarriages due to unknown causes or some other reasons, like if they have the family history of the chromosomal abnormalities or genetic abnormalities, or they have the first degree consanguinity marriage, or they wanted, the eligible couples really wanted to have a genetic assessment. In that cases, we do the genetic assessment. So before genetic assessment, we will collect the detailed history collections from the both pregnant mother as well as the father. From both the sides, we will ask the 3 degrees of, that means 3 degrees of generations of their family history. Everything we will ask, and after that only we will proceed for the diagnostic evaluations. So already in during the pregnancy period, we do many diagnostic evaluations or ultrasonographies. Addition to that, the genetic assessment is also done. So before going into the topic in detail, we must know a common terms related to genetic assessment. So what is mean by gene? It is a fundamental unit of heredity which is transferred from the parent to the offspring and held to determine some characteristics of the offspring. That means we say, no, like I have a very good eyes, I have a very good complexion due to my genetic inheritance from my parents. So that is the genetic materials is being carried out from the parents to the offsprings. Next is DNA. It is a hereditary material which is present in the nucleus of the cell. Next is chromosome. So chromosome is a thread-like structure of nucleic acid and also a protein. It is found in the nucleus of most the living cells. It carries the genetic materials. So this gene is being carried out by the chromosome. So that is a simple term regarding the gene, DNA and chromosome. So next is the genetic disorders are classified into major groups. That is, first one is chromosomal disorders. That is there any defect in the chromosomes of individuals? Either the entire chromosome, maybe either segment can be missing or entire chromosome will be missing, or whether it is duplicated again or it is been altered. So in that conditions, we get a chromosomal abnormalities. For example, Down syndrome. Otherwise, Down syndrome is known as trisomy 21. That is, in the 21st place of that chromosome, there will be a 3 sets. Actually, there should be only 2 pair. But in that case, there will be 3. That means additional chromosomes will be there. So that is and all is the abnormality. Next is single gene disorder. So it is a monogenic disorder. In a single gene, there will be any deformities. For example, thalassemia or hemophilia. Next is mitochondrial disorder. Relatively, it is a small number of disease. Next is multifactorial disorder. That means it is a combination of multiple factors like genetic factors, environmental causes. These all will cause a deformity in the unborn babies. So that, for example, is cleft lip, cleft palate, or any neural tube defects. Next is somatic cell genetic disorders. So in that categories, we have a cancers. So if is there any mutation in the several genes there in the somatic cells that causes the cancers. Next is the impact of genetic disease. So when we have the genetic disorders, it is going to affect the it is also going to give the pathway for the other abnormalities related to chromosomes and everything. And according to National Neonatal Forum, the genetic disorder is considered as the second most common cause of stillbirth, about 9.9%, and it is the fourth most common cause of neonatal mortality. It is about 9.6%. So this is a recent research, and it is mean that when the baby is developing any genetic disorders, if we are not performing any proper preventive measures or any screening measures, there is a chance of going into the stillbirth. That is, the baby is being dead in the uterus. due to the cardiac dysfunctions or any reasons. So genetic problems plays a major role in the morbidity as well as the mortality rate of the neonatal age groups. And next comes the genetic assessment. So it employs a variety of technique to determine the health condition of an unborn fetus. So it accounts for 20 to 25% of perinatal death. So first reason is managing the remaining week of pregnancies. So first, when we are doing the genetic assessment in the earlier period itself, we can we can prevent the major complications in the unborn fetus as well as the carrying mother. Next is to improve the outcome of pregnancy. So every parent or every couple wanted their unborn babies to be very healthy, and when they come out into the extrauterine life, they wanted the baby to be in a perfect form. So every parent wishes in the same way, and they pray the God in the same ways. So in that ways, we as medical professionals, we are going to help them in providing such a fetus by giving the proper screening or a proper preventive measures or any treatment modalities in the unborn baby itself. We can do it. So in that cases, the genetic assessment is very essential while performing on the pregnant mother. Next is to alleviate the possible complications. So if a baby is born with any genetic abnormalities, it is very pathetic situation for both the family as well as the babies. So the survival of the baby will be decreased due to this genetic problems. So only we have to do the proper genetic assessment so that the baby who is being born, who is medically unfit, or the baby's survival rate which is very lower, can be prevented. So only we do the proper genetic assessment and we do the proper genetic counseling to the parents. So what all history we will collect is, so first one is we will collect the family history. That is 3 generation pedigree chart will be drawn for the for the eligible couples. Then we will come to know what is the percentage of the baby is being born having the genetic abnormalities. So then also we will get the history collections regarding the mother's age and the father's age. So mother's age is equal to or more than 35 years. So there is a chance of developing any chromosomal abnormalities in them. For example, Down syndrome. Or if the father is having more than 45 or equal to 45 years, there is a chance of going the baby with achondroplasia or Marfan syndrome. So next is maternal disease. Also we will get the history collection. If a mother is having a diabetes mellitus, there is a known associated fetal abnormalities like diabetic embryopathy, caudal regression, coronary artery disease, or ear anomalies. So there is a chance if a mother is having any maternal diseases, there is indirectly or directly going to affect the unborn fetus. So only we are more concentrating on the mother's health conditions. So only we say that you have to maintain your blood glucose level in normal level, you have to maintain your blood pressure in the normal level. So because during the pregnancy there will be alteration will be there. So only we make the mothers to have a good health condition so that the unborn babies will have a good healthy environment. Next we will ask about the pregnancy history. So we do the antenatal ultrasound. So this ultrasound is going to help the to diagnose or assess the fetal growth. Next is maternal drug or alcohol ingestion. If a mother during her pregnancy period, if she is consuming any drug or any alcohol consumption, there is a chance of going the baby into any teratogenic effects. So if she is consuming any warfarin, the hypoplasia of the nasal cartilage or central nervous system abnormalities can occur. Or if a mother is intaking any sodium valproate, there is a chance of developing the babies with spina bifida or craniofacial dysmorphism. Or if she is consuming cocaine, there is a chance of baby going into vascular disruptions. Next is, if a mother during her pregnancy, if she is being exposed to the radiation, there is a chance that baby may end up with any mutagenic or teratogenic effect. Mutagenic or teratogenic effect means any deformity related to their limbs. And next is early rupture of membrane is there, means there is a chance that fetal compression may cause and that leading to deformation in the babies. Next is, if a mother is having oligohydramnios, there is a chance of baby going into renal agenesis or outflow obstruction. So these all are the pregnancy history we will ask from the mother. So we will see that she is not being exposed to any radiation, she is not taking any over the counter medications, or she is not consuming any drugs or alcohols. Next is, if she is having polyhydramnios, there is a chance of the baby going into esophageal atresia. These all are some of the history we collect from the mothers. Next is common diagnostic test. So commonly we do the ultrasonography. So during the confirmation of the pregnancy, we do the confirmatory scan. Then at 6 weeks we do the major organ develop, and by 20 to 24 weeks we do the anomaly scan. So that is in the 3 month we do a nuchal translucency scan. So why we all do this is to rule out any to rule out any physiological abnormalities is there or not, or organ how it is being developed. So along with the nuchal translucency scan, we do a double marker in order to identify the baby is having chromosomal abnormalities like Down syndrome, like that. Next is, if at all, if we are ruling out any abnormalities in this ultrasonography, we then proceed for the amniocentesis. So before we collect the history collections, during the history collections we come to know that there is a chance that the baby who is being born is going to have a genetic deformity. We will do the routine examination. Along with that routine examination, we will do the amniocentesis also. Next is maternal serum beta HCG. If it is less than 5 ml milli equivalent per ml, it is negative. If it is above 25, it is considered as a positive. Next is, again we will do the chorionic villus sampling, that is about 9 to 12 weeks of gestation. So again we don't do this chorionic villus sampling for every patient. We only do if we are suspecting any genetic abnormalities. Next is maternal blood sampling, fetal cells. So we will count the fetal cells by 6 weeks, 7 to 8 weeks, 9 to 12 weeks. So there is a normal range that it has to be in that particular value. If it is being elevated, we will suspect there is a abnormality. Next is maternal serum estriol level. So estriol is being indicated by UE3. It is being measured by nanometer mole per liter. So what is meant by estriol? It is produced by the placenta in a high quantities during the pregnancy period and exponentially rises by 34 weeks. So main function is of the estriol is to keep the uterus as well as the unborn baby to be healthy, and it also help in modulating the immune system. So we will check the estriol level in the pregnant mother. So if it is lower, it indicates the baby have a Down syndrome and maybe anencephaly or adrenal hypoplasia. Next is inhibin A. We will check the inhibin A value. Why? Because it is before that we should know what is inhibin. It is a hormone produced only during the pregnancy. So to screen any fetal abnormalities. So here also we have a normal ranges. So if there is being elevated, it means that they are having a Down syndrome or preeclampsia or any fetal growth restriction is there. Next we will do a triple or quadruple screening, combination of maternal serum alpha fetoprotein MSAFP, that is maternal serum alpha fetoprotein, beta HCG and estriol. So these all will be elevated we will check only during the pregnancy period, then only these all will be produced. So if it is being elevated or very low, means it indicates some abnormalities. Next is types of genetic testing. We do a chromosomal analysis. So we will check that in every place of chromosomes how many strands of DNA is there, how many chromosomes are there, whether it is pair is there or any extra is there or any missing of chromosome is there. So it indicates that means any duplication or single gene defect are there or multifactorial disorders are there, like that we can do it by chromosomal analysis. This chromosome analysis is otherwise known as karyotyping. So what all tissue they will check is blood, skin, amniocytes and even sometimes bone marrow. So this indicates the chromosomal abnormalities, sex determination and also cancer classification. So almost 100% we can check any abnormality is there or not by doing this chromosomal abnormalities. Next is biochemical. The routine blood and urine examination will be done. So this detect the metabolic errors or enzyme defects, prenatal neural tube defects or ventral wall defect. These all can be assessed. And next is main is maternal serum alpha fetoprotein level will be detected by the blood investigations. So these all will help in ruling out is there any abnormalities is there or not in the unborn babies. If it is there, how we can treat it in the previous itself, or if at all, if the eligible couples don't wanted to continue their pregnancy, we can also go for the next level of their choice. That's about the biochemical investigations. And next is need for genetic assessment. Mainly why we do the genetic assessment? In order to help the unborn baby who is being born to have a healthy environment, as well as the mother and the father should have a good assessment of the genetic abnormality, so that the further complications can be prevented in the unborn baby as well as the eligible couples. So once we do the proper history collections from the eligible couples or the pregnant mother, then we will proceed with the routine examination, that is ultrasonography, amniocentesis, chorionic villus sampling, along with that biochemical blood investigation or urine investigation, so that we can rule out any abnormalities in the earlier times. So we can provide a choice for the couples whether they have to continue their pregnancy or they wanted to medically terminate the pregnancy. So even every couples wanted their babies to be born very healthy. So if they're having any history of previous genetic disorder of their babies, we will go with the genetic assessment. So once we do the genetic assessment in a proper way and in the earlier time, the future complications on the mother as well as the unborn baby can be prevented. So that's all about the genetic assessment. So far we have seen some of the terminologies of the genetic assessment, and then we have seen about what are the various genetic abnormalities, broad classification of genetic abnormalities and everything. If you have any doubt, kindly drop down in the comment box. Thank you for watching.